Hi all. I wanted to make a video analyzing the case of Dr. William Husel, who is accused of murdering many of his patients with fentanyl overdoses, especially because this case hasn't gotten a lot of attention, and I think it's far more important than a lot of cases right now, like Amber Heard versus Johnny Depp. Just a disclaimer that while I am attempting to make a factual analysis of this case, what I'm saying is still my opinion and is speculative. Additionally, I am an EMT, not a paramedic, which is a higher level of training in the United States, but the term medic is a broad term which can describe anyone who provides pre-hospital field care. Dr. Husel, born in 1975, is an osteopathic physician who was employed by Mount Carmel West Hospital in Columbus, Ohio, as an ICU doctor from 2013 until his termination on December 15th of 2018. He graduated from Ohio State in 2000 with a degree in microbiology and graduated from Ohio University College of Osteopathic Medicine in 2008. He then went on to complete a residency and fellowship in critical care medicine at the prestigious Cleveland Clinic. By most accounts, Dr. Husel was an extremely intelligent, friendly, competent, and well-liked physician. Starting in 2015, Dr. Husel ordered high doses of fentanyl, a very powerful synthetic opioid painkiller, to some of his patients who were placed on palliative care due to terminal or untreatable illnesses. For those who don't know, palliative care is essentially comfort care given to those with terminal illnesses. It's essentially related to hospice care. Pain medications are given frequently to palliative care patients in order to minimize the amount of discomfort that they may be experiencing and to make their transition out of this world as peaceful as possible. Some of the other employees at Mount Carmel West noticed that Dr. Husel had sometimes prescribed fentanyl doses that were much higher than average to some of his palliative care patients and brought it to the attention of supervisors. A formal report regarding Dr. Husel's gratuitous use of fentanyl was created and reviewed by Mount Carmel Hospital in October of 2018. About a month later, the death of another palliative care patient who received a high dose of fentanyl caused hospital administrators to initiate a more thorough investigation. Dr. Husel was placed on administrative leave pending the completion of the investigation, leading to his eventual termination. Mount Carmel subsequently notified the state medical board and county prosecutors. Ohio State Police became involved in the investigation, notifying the state nursing board in the process. Dr. Husel's medical license was suspended during the investigation. He was arrested on June 5th of 2019 and charged with 25 counts of murder in relation to palliative care patients to whom he had prescribed fentanyl. The judge dismissed 11 of the counts due to insufficient evidence. The extensive trial began on February 22nd of 2022. His lead defense attorney was Jose Baez, who is famous for representing Casey Anthony and Aaron Hernandez. He's been compared to many other successful lawyers such as Johnny Cochran, F. Lee Bailey, and Benjamin Brofman in terms of his ability. The prosecution argued that Dr. Husel's doses of fentanyl hastened the death of his terminally ill patients, which constituted murder, as physician-assisted suicide and euthanasia are not legal in the United States, even with the patient and or family's consent. They argue that the extremely high doses given to some patients indicated a clear intent to kill them faster than the disease process itself would. The defense argued that Dr. Husel used whatever dose of fentanyl was necessary to relieve the patient's pain and make them comfortable, regardless of how much fentanyl it took to accomplish this goal. They went on to argue that the prosecution did not prove that the deaths of the patients were actually due to the fentanyl doses versus their underlying disease process. Numerous doctors, clinicians, hospital employees, expert witnesses, family members of the alleged victims, and others testified during the trial. The prosecution called 53 witnesses in total, and the defense only called one, Dr. Joel Zivit, who worked at Mount Carmel as an anesthesiologist and intensive care specialist. He testified that the fentanyl doses given by Dr. Husel were for the purpose of comfort care, and that all of the patients he was accused of murdering died from their illnesses rather than fentanyl overdoses. The jury went into deliberation on Thursday, April 12th, 2022. On Monday, April the 18th, the jury reported to Judge Michael Holbrook that they were at an impasse and could not reach a unanimous verdict. He ordered the jury to continue deliberations after taking a lunch break. On Wednesday, April the 20th, the jury found Dr. Husel not guilty, acquitting him of all counts. The trial was long and involved far more detail than I can cover in one video, but I would like to offer my general thoughts on the case. With that aside, do I believe Dr. Husel was guilty or not? Based on the information available, I believe he was innocent. It appears to me that this entire case was a massive witch hunt to begin with. It was a clusterfuck of a case, and I think his arrest and prosecution were due to a systemic failure on multiple levels. It seemed to be a large-scale act of negligence by all parties involved in the investigation and prosecution of Dr. Husel. Every constituent involved in the case failed tremendously, from the hospital to the law enforcement agencies to the prosecutors and even the trial court judge, which I will discuss here in a moment. Many of the patients Dr. Husel was accused of killing received average doses of fentanyl. Only some of them were given extremely high doses, and many of them were taken off life support by the doctor on the previous shift rather than by Dr. Husel. To me, it appears that the fentanyl doses were titrated based on what each specific patient needed in order to achieve maximal pain relief, leading to some patients receiving typical doses of fentanyl and others receiving very high doses of it. One thing I'll mention related to the systemic failures in this case before discussing the actual details of the case is the behavior of Judge Holbrook. He was obviously biased towards the prosecution from the beginning. He was nodding his head while the prosecution was making various points during the trial, and he sustained almost every objection raised by the prosecution without first even listening to what the objection was. Conversely, when Mr. Baez was speaking, he sat with his arms crossed and more or less glared at Baez, not to mention that he rarely sustained any objections raised by the defense. Near the end of the trial, a motion was filed to disqualify Judge Holbrook based on his behavior, which postponed closing arguments and the beginning of jury deliberation for several days. The motion was denied, and the trial went forward. In my opinion, calling Judge Holbrook's conduct inappropriate is an understatement. The judge is arguably meant to be the most impartial person in the entire courtroom. For him to decide early on that he was going to try and sway the jury towards convicting Dr. Husel was a reprehensible act for a trial court judge. In a jury trial, it is not the job of the judge to determine the guilt or innocence of a defendant, and I believe that Holbrook violated his oath of office through his conduct. Now, in EMS, we have a set protocol for each medication we administer. Determining the specific doses for a certain medication is influenced by many factors, including the effect that the medication is intending to achieve, the height, weight, and age of a patient, and the route of administration, among others. We can only deviate from these protocols if we contact online medical control, which is almost always an on-duty physician and usually an emergency physician. In hospitals, doctors have general guidelines that they stick to regarding medications, but they can deviate from the typical uses and doses of medications based on the specific situation. There is not a one-size-fits-all answer in medicine due to the virtually infinite complexity of the human body, and physicians can tweak their practice a bit if they find that it is necessary. When it comes to patients who are placed on hospice or palliative care, there is no maximum amount of an opioid painkiller that can be given to a patient. The physician can order the administration of the pain meds as often and as much as is needed until the patient is or appears to be pain-free. For the patients of Dr. Husel who received abnormally high doses of pain meds, he gave them the dose that was necessary in order to ensure comfort. I once spoke with an emergency department nurse who was also a nursing supervisor about a patient she had once. The patient was an older woman who had an incurable medical emergency but was awake and alert. Per doctor's orders, morphine was administered to this patient multiple times an hour for, if I recall, a 16-hour period. The patient surprisingly never became altered or unconscious due to the morphine, and she eventually passed away due to the medical problem that she was suffering from. The prosecution theory of this case implied that Dr. Husel went a step beyond providing comfort care and used high enough fentanyl doses to kill his patients. The prosecution alleged that he killed them with fentanyl not as an act of malice, but essentially as an act of physician-assisted suicide. They argued that he brought their deaths on faster with fentanyl overdoses, which was murder, since euthanasia is considered murder under U.S. law. Their main point was that hastening the deaths of people who are already going to die still qualifies as murder. I think the prosecution not only failed to prove that Dr. Husel had intent to kill, but I don't think they had any evidence to show that the patients died from anything other than their diseases. As Jose Baez said, they didn't prove that the patients died from fentanyl overdoses. Sometimes there are legal cases that bring laws or other government-instituted protocols into question. This entire case brings into question whether physician-assisted suicide done with the consent of the patient should actually be illegal. While I have cared for many hospice and palliative care patients during my career, I had personal experiences with palliative care starting when I was 10 years old, which was long before I entered the medical field. My paternal grandmother died of a rare disease called PSP, which stands for progressive supranuclear palsy, in 2007, which is essentially where you have widespread brain cell death, and it presents similarly to ALS in terms of losing most all motor function during the course of the disease. My maternal grandmother died in 2010 after a long battle with pneumonia and COPD complications that she just couldn't overcome. My maternal grandfather died from complications of heart failure in 2015, and several months later my paternal grandfather died of a glioblastoma, which is a form of brain cancer. All four of my grandparents died very slow, debilitating deaths from terminal medical conditions. Now, I come from a very conservative family, but these deaths opened up the minds of some of my family members to the legitimacy of physician-assisted suicide rather than just comfort care at the end of life. I personally do not believe in euthanasia or physician-assisted suicide due to ethical, philosophical, and theological reasons, but this still begs the question, should it be illegal? I believe that every adult has the right to freedom and self-determination, meaning that not everything that is bad should necessarily be illegal if you aren't hurting anyone else. If you want to get drunk every day after work and go on a bender every weekend, you should be allowed to if you are not disregarding agreements with and obligations to other people. It's your life, and you have the right to be an alcoholic if you wish, even though alcohol is a neurotoxin that will cause substantial health problems and an early death if excessive use is sustained for long enough. Now, how does that tie into euthanasia specifically? I think many of the laws banning euthanasia around the world are not based purely in ethics and morality, but are also based in religious and theological reasoning, and thus do not acknowledge the right of the individual person to freedom and self-determination. There are many things that I do not believe in or agree with, but I believe other people who are not physically aggressing upon anyone or their property should have the right to say and do as they wish. With that being said, I think that provided an individual is mentally competent and the terminality of their disease is absolute, meaning that it is 100% certain that the patient will die, it should be legal for them to opt for euthanasia. Families and doctors should not be allowed to make that decision for the patient, especially if the patient is no longer mentally competent, meaning that the patient and the patient alone is the only one to make such a decision while they are in a lucid mental state. I think that if euthanasia were legalized in the United States, the prerequisites I propose to qualify for euthanasia must be abided by in a strict fashion and rigorously enforced by authorities. You shouldn't be allowed to use euthanasia for non-fatal chronic illnesses, mental illness, or birth defects. Under this model, any time that euthanasia bridges into the realm of the eugenics, it is a huge no-go. It should only be legal so that a patient can choose to avoid suffering from a terminal condition. Euthanasia aside, I think one factor that influenced this case is the public's overall negative feelings about fentanyl due to the opioid crisis. The drug is so strong and the body is so susceptible to fentanyl overdoses that for medicinal reasons, it is administered in micrograms rather than milligrams. A microgram is very small, 1/1,000,000th of a gram. Street drugs laced with fentanyl cause numerous overdoses every day, many of which result in death. On-duty first responders sometimes overdose on fentanyl by coming into physical contact with small flakes of fentanyl which are almost imperceptible to the naked eye. Some concerns about fentanyl are legitimate, but many concerns about it are misguided. If you approach the issue with some basic chemistry in mind, there is no substance that is always harmful or bad to the body, regardless of the dose. The dose makes the poison. The pathogen that causes botulism produces the botulin toxin, which is the most powerful toxin known to man. 1 gram is enough to kill 10 million people, but even a small enough dose of the botulin toxin would be harmless. The most vital elements to the human body, such as water and oxygen molecules, are toxic in high enough amounts. With that information in mind, safe doses of fentanyl are given to thousands of people in the U.S. on a daily basis. Some people are given fentanyl for short-term pain relief through IVs, while others wear long-acting fentanyl patches on their skin. Fentanyl and all other opioids are legitimate when given in the right doses, for the right reasons, and to the right patients. Fentanyl is not the only hard drug or street drug that has medicinal uses. There are legitimate medical uses for heroin, cocaine, magic mushrooms, and even methamphetamine. That's right, even meth can be used as a medication under the right pretenses. The biggest red flag in this case is that the government created the opioid crisis to begin with, but now it is cracking down on the problem that it created in the first place. Due to greed, the government and pharmaceutical companies were allowing and even incentivizing doctors to prescribe opioids ad infinitum without considering the consequences. Fast forward a number of years, and now we have not only the opioid crisis, but also a crisis of excessive government control. Providers were afraid to give opioid painkillers for the right reasons before Dr. Husel was ever arrested, but I would imagine his arrest and trial has increased this fear in some providers. Seeing as the jury was deadlocked several days before acquitting Dr. Husel, he was terrifyingly close to being sentenced to death or life in prison without the possibility of parole if he was convicted of even one of the charges. At the end of the day, the pendulum on the opioid crisis swung too far in one direction, and as is characteristic of life, the pendulum has swung back too far in the other direction. Dr. Husel was prosecuted due to the lie asserting that fentanyl and other opioids are somehow inherently bad, no matter the context. Thank you for watching. Please consider liking and subscribing.